At this point, the clinician will already have non-sterile gloves on. The first layer of the Erase CAUTI one-layer tray contains 3 components. The first component is the patient education card. It's written in both English and Spanish and explains to the patient why they are receiving a Foley catheter. This education is also listed in the Joint Commission CAUTI National Patient Safety Guidelines. Next is the perineal cleansing wipe, a thick, strong cloth used for general perineal cleansing. Third is the under buttocks drape. Place the drape with the shiny side of the drape down. This drape is placed before caregivers don sterile gloves. Simply apply the under buttocks drape and then remove your non-sterile gloves. The second layer of the tray contains 2 components. First is hand sanitizer. Apply hand sanitizer and allow to dry. Next comes a set of sterile gloves. This process removes the possibility of cross-contamination. The third layer of the tray contains the necessary sterile components. At this point, the caregiver is now working in the sterile field and will prepare the kit from left to right. There are arrows on the top of the tray that indicate this as well. First, attach the sterile water syringe to the inflation port, but do not pre-test the balloon. Next, spread the lubrication jelly into the lubrication trough in the tray. Remove the protective sheath of the catheter and place the catheter in the lubrication trough to properly lubricate before insertion. On the right-hand side, there will be 3 PVP swab sticks, which are conveniently pre-saturated. Open this package to prepare for the insertion process. Next, place the fenestrated drape and hold in place with the non-sterile hand. For females, using your dominant hand and with a downward stroke, use the first swab stick to cleanse one side of the labia minora. Repeat for the other side of the labia minora. Use the last swab stick to cleanse the area between the labia minora, crossing over the meatus and discarding the swab. For males, with your non-dominant hand, retract the foreskin if present to visualize the meatus. Using the first swab, apply PVP around the tip of the meatus, cleansing the glands. Repeat with the 2 remaining swab sticks. Then begin the insertion process with the catheter with your designated sterile hand. Once the catheter is fully inserted, inflate the balloon with your non-sterile hand while holding the catheter in place with your sterile hand. Gently pull back until you meet slight resistance to ensure the balloon is at the base of the bladder. Once this is complete, secure the securement device to the patient's leg. Start by applying the alcohol prep pad. Allow to dry for 15 seconds. Then, apply the SurePrep pad and allow to dry 15 seconds as well. Secure the device to the sample port on the tubing or the vented connector if applicable. Remove the backing of the device and apply to the patient's leg. Press down on the foam to maximize wear time.